Let's talk some bronchodilators for now. There's three types of bronchodilators: xanthine derivatives, beta-adrenergic agonists, and anticholinergics. Xanthine derivatives, they cause bronchodilation by relaxing smooth muscles of the airways. They're mildly anti-inflammatory. They do result in the relief of bronchospasms and greater airflow into and out of the lungs. They cause mild CNS stimulation and also cause mild cardiovascular stimulation by increasing the force of contraction, or inotrope, and increased heart rate, chronotropes. They're used for dilating the airway in asthmas, chronic bronchitis, and emphysema. It's used in mild to moderate asthma, acute asthma, and as an adjunct agent for the management of COPD. Two of the drugs in this category would be aminophylline and theophylline. Now, there are some significant side effects with xanthine derivatives. Nausea, vomiting, anorexia, and gastroesophageal reflux during sleep are significant, but the dangerous ones would be sinus tachycardia, palpitations, and seizures, as well as ventricular dysrhythmias. We need to monitor lab levels to avoid toxicity and to check for therapeutic blood levels for xanthine derivatives. They need to be given cautiously with geriatric patients because of their increased sensitivity due to decreased drug metabolism. Some of the nursing implications: if you drink coffee or eat chocolate, they can have an additive CNS and cardiac effect. Eating charcoal broiled foods can actually decrease effectiveness due to the charcoal absorbing the xanthine derivatives. In client teaching, we need to make sure the patient reports to the physician any of those symptoms we talked about earlier: palpitations, severe nausea, vomiting, dizziness, chest pain, any weakness or convulsions. Now, bronchodilators are sympathomimetics. These are used during the acute phase of asthma attacks. They quickly reduce airway constriction. They stimulate the adrenergic receptors, which relaxes smooth muscles of the airway and again results in bronchial dilation and increased airflow. Three types of bronchodilators or beta agonists. There's non-selective adrenergic, which stimulates alpha, beta-1, and beta-2 receptors. This is epinephrine. Non-selective beta-adrenergic stimulates both beta-1 and beta-2. This would be isoproterenol or isoprel. But for asthma, we're looking at selective beta-2, and these only affect beta-2 receptors, and this is albuterol. Brand name is Proventil, Alupant, Ventolin. They're all albuterol. This is short-acting. It's for emergency relief of bronchospasms by relaxing and dilating the bronchial airways. Long-acting are not used for emergency relief of symptoms. They control asthma symptoms also by relaxing and dilating, but these are not short-acting. So some of the side effects: restlessness, headache, insomnia, tremors, cardiac stimulation, chest pain, palpitations, and anorexia. And again, remember, anorexia here is lack of appetite. There's two types of beta agonist delivery methods: nebulizers and a metered dose inhaler, or an MDI. MDIs are simple to use. They can be stuck in your pocket or a purse. They work very well, but only if you have good enough airflow where you can actually draw it into your lungs. Nebulizers require a nebulizing machine, a pump. They are slower, 5 to 10 minutes per dose. But because they're slower, that's their big advantage. If you have a major constriction, every breath brings a little bit in. So every breath helps open up that airway a little bit more, a little bit more, a little bit more. So those are very useful at home. Downside is the machine is about that big, so it's hard to stick it in your purse and take it with you where you're going, or stick it in your backpack. So there are pros and cons for both. You get the same end result as long as you can get the medication into your lungs. For metered dose inhalers, there's also two types of those. There's aerosolized and there's dry powder. Aerosolized are the little puffers where you squeeze that and it just shoots it into your lungs. The downside with those is if you don't breathe at the right time, it just goes in your mouth. So it takes some timing. Very difficult with children. With children, you can use a spacer, which tends to leave it in the air longer. But still, it does take some practice. The dry powder, Spiriva uses a dry powder. Advair uses a dry powder. Those Advair discuses. That requires no timing. So you don't worry about squeezing the puffer and inhaling at the right time. However, if you don't have a good ventilation ability, if you can't get that air in your lungs, you won't be able to get that dry powder back down there. Again, pros and cons with both. We want to avoid exposure to conditions that precipitate bronchospasms. If you're allergic to cats, avoid cats. That's one of my allergies. So we're going to avoid allergens, smoking, stress, and pollutants. We're going to ensure we have adequate fluid intake, compliance with medical treatments, avoid excessive fatigue, heat, extremes in temperature, caffeine. For assessment, we're going to look at skin color, vital signs, respirations, how frequently, how deep, how shallow. Is there sputum? Are they having allergic reactions? We're hoping to see decreased dyspnea or difficulty breathing, decreased wheezing, restlessness, and anxiety, improved respiratory patterns with a return to normal rate and quality, and improved activity tolerance. Anticholinergics, ipratropium or Atrovent, or tiotropium, Spiriva. Acetylcholine causes bronchial constriction and narrowing of the airways. So anticholinergics bind to the acetylcholine receptors, which prevents acetylcholine from binding. The result is bronchoconstriction is prevented and airways dilate. Anticholinergics are slow, but they have prolonged action. These are used for prevention. They cannot be used for acute asthma exacerbations, and these are used mainly for emphysema. Some of the side effects, well, what are the anticholinergic side effects? Dry mouth and throat, GI distress, headaches, coughing, and anxiety. One of the good things is there are no known drug interactions. So there are two different classes of drugs that do a similar thing in different manners. Bronchodilators and anticholinergics. In the next section, the last section, we're going to talk about anti-inflammatories.